When I found out about the students at the schools in Collingwood, I became very concerned. They were having headaches, they were having difficulty concentrating, as you heard the young boys say. I was most concerned when I found out they were having heart palpitations. And the reason for that is just a few years ago, 2 years ago, we started a study looking at the effects on the heart. People who are electrically hypersensitive complain about heart palpitations, pain and pressure on the chest, and very often they say it's almost like I'm having an anxiety attack or I'm having a heart attack, and it really scares them. And so we began to do a proof of concept kind of study where we had people volunteer to be tested, some of whom were electrically sensitive, and we simply exposed them to normal radiation that you would have in the environment. And the way we did this is we hooked them up with a chest monitor. We took a cordless phone that has a frequency of 2.4 gigahertz, so the same frequency that we use for Wi-Fi. We plugged it into an outlet, it radiated. We plugged it into a dead outlet, and it stopped radiating. And so this was a double-blind study where the person who was being exposed didn't know exactly when they were being exposed, and the person who was analyzing the data didn't know when the person was exposed either. And the computer program that we used monitored, it was real-time monitoring. Every single beat of the heart was recorded. And when you have high lines here, that's the time between beats, so that's showing a slower heart rate, and down here we have a faster heart rate. We expose them to a power density, which is the intensity of the radiation, was 3 microwatts per centimeter squared. The guidelines we have here in the United States, the Federal Communication Commission guidelines, and the guidelines we have in Canada say that you can be exposed for any 24-hour period to 1,000 microwatts. So we're at 0.3% of the guideline, very low level of exposure. We expose people for a 3-minute period. For you here in the United States, the FCC guideline is average exposure over 30 minutes. In Canada, it's average exposure over 6 minutes. So we're well below, we're not exposing anyone to anything that should be harmful to them at all. And these are the results we got, and I'm simply going to show you 2 of the results. Here we have the heart, and you can see that there's nice undulations in it, and we have 3 time periods. This is 1 period here, another period here, and a 3rd period here, each lasting about 3 minutes. So during one of these periods, or more than one of these periods, the person was actually exposed to microwave radiation. This was the period that they were exposed. And so Dr. Jeff Marangel, who's a doctor of chiropractic and uses this technology in his practice, would look at these results and determine whether or not that person was exposed when they were exposed, and whether their response was positive, negative, or neutral in terms of the heart. And in this particular example, the heart rate was 58, 56, and 58 beats per minute. There's no difference. This was a non-responder. This is another person. Okay, you don't have to be a cardiologist to interpret this. This is when the person was exposed. It was like an on-off switch. As soon as we turned the microwaves on, they went into something called tachycardia. Their heart rate increased from 68 beats a minute to 122 while they were lying down resting. In some cases, some of the people actually fell asleep during the testing because it was such a relaxing environment. As soon as we turned off the phone, it dropped back to normal, and as soon as we turned it on again, it jumped up again. This is an absolutely definitive study, experimental, showing that these individuals are responding to microwave radiation at non-thermal effects well below the existing guidelines. And it's one thing for a person, an adult, to go into a building, find out they're having a rapid heart rate. They can go out of the building if they know this is what's happening, and their heart will return to normal. It's quite different when you have a child in a classroom who suddenly has a rapid pulse and doesn't know what the heck is going on. And that's why some of them are on heart monitors to find out what's actually causing this. After I got the information about the schools in Ontario, I started contacting some of my colleagues around the world and asked if they had any reports of problems with children who were going to schools with Wi-Fi. And this is one of the emails I got just a week ago, and I'm just going to read it verbatim to you. We lost 2 students to cardiac arrest in San Anselmo in the past 12 months. Both fell dead within 100 yards of major cell towers. One was in gymnastics, a 5th grader. The other was taking a shower, a boy who was a junior in high school. It was thought the congenital birth defects were to blame for both, but that sounds speculative to me. This isn't me writing it, it's someone else writing it. Was it Wi-Fi, cell towers, or just chance? I will say if another kid dies in San Anselmo in the next 2 years, it will be time to investigate. I'm not an expert in sudden cardiac arrest, and I don't know what the prevalence is in the society, so I began to do some research in this. And this is one of the papers I found. Survival trends in the United States following exercise-related sudden cardiac arrest in youth during the period of 2000 to 2006. And I'm just going to summarize the salient points here. This study was done for children between the ages of 5 and 22 over a 7-year period, and during that period there were an average of 70 cases a year in all of the United States. So you have 2 kids in one city who are suddenly having this happen. That's a very, very high percentage. And if you had a third, I think that would be very, very disturbing. Same with the students in Collingwood. There were, I think, a total of about 4 to 6 students in the school district that were complaining about heart palpitations and heart problems. That's a very, very high percentage. In Canada, the average should be 7 per year who have anything like this happening to them. Here's another study, out-of-hospital cardiac deaths in adolescents and young adults in the United States during an 8-year period from 1989 to 1998. The results from this show that age-adjusted out-of-hospital cardiac death rates increased in men during this 8-year period by 11%, in women by 33%, African Americans by 11%, and whites 19%. This is a very rapid increase, and no one knows why it's happening. Interestingly enough, during that period, we've had an explosion in the amount of wireless technology we're exposed to, from cell phones to wireless technology in the home as well. The conclusions are that although cardiac death remains rare in the United States adolescents and young adults, the increased trend in out-of-hospital cardiac death, so these are people who are not in hospital because they have heart disease, they suddenly they suddenly drop dead for no obvious reason. The increased trend in this age group warrants further investigation. So this is something that we really have to start taking a look at very, very seriously. When we look at the school environment, there are basically 2 sources of exposure to wireless technology. One is within the school that you generate yourself, and the other is coming from outside the school from nearby antennas. And by the way, if you happen to live near the ocean, you can have marine radar. That's a serious problem. Weather radar, military radar if you're near a military installation, and airports if you happen to be near an airport. Radar uses microwave radiation. It's the same type of frequency. And that brings me to another study. What about things outside of the school environment? Well, we're very concerned about antennas near schools. And a few years ago, I started a study with my students, and it's called the Bragg Antenna Ranking of Schools Study. And what I did is I went to antennasearch.com that gives you a rough estimate. It's not accurate, but it gives you a rough estimate of how many antennas are near a particular address that you put in there. And so the question we asked are, how many antennas are near schools in the United States? And I restricted the search to capital cities. So we did one for each state capital, and we did Washington, D.C. And we took 3 different metrics. One was the closest antenna to the school, the number of antennas within a quarter mile, and the number of antennas within 1 kilometer. The closer you are, obviously, the higher the radiation is going to be. So this is a surrogate for radiation, because we didn't have the money to go to individual schools and do measurements, which is the ideal way of doing it. We did 50 states plus Washington, D.C. In total, we did over 6,000 schools, and that covered about 2.3 million students. This took several years, and my students in several of my classes were doing this, so I'm very appreciative to them. When we got the information, it was, you wonder, how do you present all of these numbers to people? So we graphed everything into a small classification system using traffic lights. So the more antennas there are, the black or the red, the fewer antennas there are. We used a green scale, and that's what Bragg comes from. Bragg stands for black, red, amber, and green. Okay, so that's what we really stand for. And I just wanted to show you some of those results. And we did Sacramento, obviously, that's the capital of California. It was the 12th state, capital city in the 12th state, with 1 being the best, the lowest, fewest number of antennas near schools. And here we found that only 1% of the schools have really a lot of antennas nearby, and 7% have quite a few antennas nearby. 45% are relatively clean, which means they don't have antennas on or near school property. The worst city was Boston, Massachusetts. And this is what they looked like. So here we're talking about roughly the same number of schools, 260 versus 280. Here almost 50% of the schools are red or black, which means they have a lot of antennas on school property or close to schools. And just to give you the results for the worst case in Sacramento, the closest antenna was within 0.1 mile, so it's obviously very close to the school. There were 18 antennas within a quarter mile from one school, and there were 150 antennas within a kilometer of one school. Okay, that's for Sacramento. This is what it is for Boston. It's right on school property. 300 antennas within a quarter mile. 750 antennas within 1 kilometer. I would not want my children or grandchildren attending a school like that because they are being fried by the microwave radiation. Why should we be concerned? Well, we should be concerned because people who live near cell phone antennas are complaining of all sorts of problems, and there have been a number of studies documenting this. This happens to be a study that came out it was done in Spain, and it was done by Santini in 2001. And what this shows you, the height of these bars show you the percentage of people who are responding very often to questions like, how often do you experience fatigue? How often do you experience headaches? How often do you experience difficulty in concentrating? Everything in red is within 10 meters, or about 30 feet, of an antenna, and all the way out to about 300 meters in the black here. And these are the symptoms in order: fatigue, sleep disturbance, headaches, feelings of discomfort. Every single one of these that are in red are things that we tend to associate with aging. And so I call this rapid aging syndrome. And very often when I talk to people who might be electrically hypersensitive, what they tell me is, well, I'm just getting older, or I'm under a lot of stress, and that's why I can't sleep, and that's why I'm tired all day, and that's why my knees hurt and my back hurts. However, the difference between true aging and electrohypersensitivity or rapid aging syndrome is that when you go into an electromagnetically clean environment, your symptoms go away. You sleep well, you don't have pains, you can think clearly, you don't have headaches. So that's the real test as to whether or not you're sensitive to this radiation. According to one study that came out in 2006, this is the estimated prevalence of electrohypersensitivity in various countries. And according to the study, by 2017, 50% of the population are going to have these symptoms. So they're very common symptoms, but they're debilitating in some cases, and they certainly interfere with the quality of life. We also know that if you happen to use things like cell phones or cordless phones, that you have an increased risk of developing a tumor on the same side of your head that you use the phone after 10 years. And you can develop either a brain tumor, a tumor of the eye, or a tumor of the nerve responsible for hearing, also salivary gland tumors. And this is simply a model here of a 5-year-old child, a 10-year-old child, and an adult, showing the amount of penetration coming from holding a cell phone to your head. And we know that children are more vulnerable for a variety of reasons. They absorb more energy, they have a longer lifetime exposure, they don't have a developed immune system, and they're growing very rapidly. So if a child develops a brain tumor, it's going to be a fast-growing brain tumor, and they're unlikely to make it to the age of 10. When an adult develops a brain tumor, it's usually slow-growing, and it takes anywhere from about 20 to 30 years for it to manifest itself. So what we're finding is in adults, the tumors are showing up after 10 years. So they're much more rapidly growing tumors than what we're accustomed to. But it's not just brain tumors. The head of the Interphone study, Elizabeth Cardis, was a co-author on this particular research, and it's looking at salivary gland tumors, which is a gland right on the side of your face here. And I don't know how many of you know Roger Ebert, but he developed a salivary gland tumor, and this is what he looks like now. They have to remove a part of his jaw. He's unable to speak, and he's unable to eat solids. He eats food through a straw, basically. And I'm not saying his salivary gland tumor came from a cell phone, but this is one of the consequences of developing a salivary gland tumor if you survive it.